Hi guys, today I'm going to be presenting hypernatremia, and be patient with me because I'm just recovering from a horrible cold. So hypernatremia is an excessive sodium level in the blood and extracellular fluid. So it's a sodium of more than 145. The normal sodium levels for adults and children are 136 to 145. For full-term infants, it's 133 to 142, and for preemie infants, it's 132 to 140. So the pathophysiology of hypernatremia is excess sodium that results from ingestion of large amount of sodium without appropriate water intake, or from loss of water from the body that is faster than the loss of sodium. Some examples and risk factors include watery diarrhea, vomiting, fever, kidney disease, prolonged periods of rapid respiration, loss of thirst mechanism, poor control diabetes. A good example now that everybody is sick will be the norovirus. Kids are vomiting, they have diarrhea, they're not drinking. So those kids, some of the kids that often come to the hospital with hypernatremia, and we have to keep eye on those kids. Again, some of the symptoms are thirsty, the tongue and the mucous membranes are dry and sticky, they're weak, they're lethargic, they're also very agitated. It's very hard to keep them calm, they're tired, they're super dehydrated. They have decreased urine output because of the ADH is secreted, edema, elevated blood pressure. I do have to say that it's important to know that the manifestations can change depending on the cause of the problem. So if the cause of the hypernatremia is fluid loss caused by lack of ADH, the urine output is high. So that is important to know. Hypernatremia is uncommon, but when it does occur, it's associated with the following conditions. So dehydration, Conn's syndrome, coma, Cushing's disease, diabetes, and tracheobronchitis. Also, there are many drugs that can affect and can cause hypernatremia, and those are corticosteroids, calcium, fluorides, and iron can cause increase in sodium levels. Also, heparin, sulfates, and diuretics. Some of the diagnostic tests for hypernatremia are electrolyte panels with BUN and creatine, serum electrolyte panel, urine and serum osmolality, and urine electrolytes. Also, the diagnosis test for hypernatremia can vary depending on the symptoms and underlying conditions. Hypernatremia definitely induces diverse effects in multiple organ systems, with short-term mortality of approximately 50 to 60%. Even mild hypernatremia can confer a 30-day mortality of more than 20%. So it's important that we keep eye on these patients and provide the care that they need. Well, guys, that's all for today because I don't feel great, unfortunately.